Hello and welcome on campus at SUNY New Paltz. I'm Devon Duhaney. On campus at SUNY New Paltz is a series of programs about SUNY New Paltz and its community. My guest today on campus is Dr. Peter Haughton, the Director of the Student Health Services here at SUNY New Paltz. Welcome on campus, Dr. Haughton.
Thank you very much.
I suppose with the start of the new school year, new semester, have you ever seen such an intense start to a school year as you've seen?
I actually don't recall in my 33 years of being here. This is probably the most intense.
And we're talking the intensity we're referring to here is all because of the
novel H1N1 virus.
Swine flu.
Swine flu. Yes, the preparation for it and trying to educate students as they came on board.
What were some of the things you started out by doing prior to students coming on campus and even after they got on campus?
A big part of it, getting posters up about all the preventive measures, the important preventive measures. Careful, strict hand washing, etiquette about coughing into the elbow, bend of the arm, or into a tissue, not in one's hand. And
why is that the case? What makes the difference here?
The virus, the influenza viruses, including the novel H1N1 virus, is spread in droplet form. So it needs a vehicle.
Yes.
It just doesn't on its own get up and grab us.
Right.
And so when one coughs or sneezes,
there's a spray.
There's a spray. The virus is part of that spray. And if one is within 6 feet of the origin of the spray, one is very likely to be exposed, and then exposure means more likely to be infected. Mm-hmm. So we sort of need to have students always remember that the coughing, sneezing etiquette, and that if they have symptoms, if they've been told they have flu-like symptoms, that and somebody is bringing them a sick tray, for example, a buddy in the buddy system, bringing them a sick tray, that they'll wear a surgical mask if they have been coughing or sneezing, so that they really decrease the likelihood of somebody helping them who is healthy, decrease the chance of them contracting it. Yes.
Good. Now, the majority of our community here at SUNY New Paltz is within the age group that's considered at risk.
Correct.
Why is it that this group is at such great risk for the H1N1? And we're talking about the 18-25 age group.
We're actually talking about from infants right through to about 25 years of age.
Yes.
Yeah. It appears that their immune systems have never encountered a virus similar to the novel H1N1 virus before. So having not encountered it before, the immune system wouldn't have a memory. Immune systems in general have an excellent memory for organisms like viruses, particular viruses that they've encountered before. They have cells that have a specific memory for that virus and can readily develop antibodies to that virus. So the feeling is that older people have been exposed to a virus that's similar to the novel virus in the past, and so that their immune systems have a memory, so that with the virus circulating and with older populations certainly getting exposure to it, it's much more easy for them to stave it off because they develop antibodies much more quickly. They don't have to start de novo. They already have a factory that has produced antibodies similar to this before, and it just has to be the doors opened up and they start producing again. Whereas when you've never been exposed, it takes probably about 5 to 7 days for the immune system to gear up and develop new antibodies for a new agent that they have no familiarity with.
We've had reports of a surge of the H1N1 on a number of campuses here in New York, around the country. What's the state of affairs here on our campus?
Here at New Paltz, we really haven't seen what we would call a surge. We started out from the get-go. We started out seeing maybe 2 or 3 cases, new cases a day in the student health service.
Are these new cases of H1N1
new cases,
seasonal?
New cases of flu-like illness.
Okay.
And because of the epidemiology, it's assumed that there are new cases of the H1N1 because that's the prevalent virus in this area at this time.
So you're saying that when a patient comes in, you're not taking it for granted that this is just the seasonal. You're looking at the possibility of H1N1.
We're assuming
yes
that this is H1N1. Normally, you don't see the seasonal flu virus at this time of year. This is relatively early.
Right.
You would begin to see the flu virus probably in late October around here, and definitely when students came back from the Thanksgiving break. So everything points to the novel virus. So we assume, and so when a student comes into the health service, the moment they open the door and come to the reception desk, there's a questionnaire that everybody fills out, and there are 4 or 5 of the symptoms and signs of flu-like illness. And if they check off any of them, particular cough or sneezing, they get a surgical mask, and then they're escorted to the sick waiting room, which is a separate waiting room that's vented directly to the outside, so that the air is circulated.
So you remove them from the general
circulation, and they're examined by staff who wear the fitted N95 respirator masks, which all healthcare personnel are required to wear. And they're examined in again, a different room, an isolation room, which again is vented to the outside. So that's the way in which we try to prevent spread of the virus within our facility.
Are you seeing a rush on the services at this time compared to, say, a year or 2 ago?
Well, it's interesting. We're always busy, and I would say that we're at least as busy as at this time as we've been in previous years. But the remarkable thing is that such a large proportion of the daily illnesses is a flu-like illness. And that's really very different. That's what's remarkable this time around.
I tell you what, we'll come right back and continue our discussion looking at some of the characteristics and features related to the swine flu, and some other discussions on issues related to health services here on campus. We'll be right back on campus at SUNY New Paltz.
As part of the Distinguished Speaker Series, SUNY New Paltz welcomes the Honorable Mayor of Newark, New Jersey, Cory Booker, as he presents How to Change the World with Your Bare Hands. This inspiring discussion will engage you in civic responsibility and encourage personal involvement in creating change within your community. As Mayor Booker says, change comes from good people coming together with collective struggles and doing something about it.
Welcome back on campus at SUNY New Paltz. I'm Devon Duhaney, and my guest today is Dr. Peter Horton, the Director of the Student Health Services here on the campus at SUNY New Paltz. Welcome back. We've been talking about the novel H1N1 flu, symptoms and all of that. Now, we are approaching what would be considered, based on what was said earlier on, the onslaught of the regular flu season. Mm-hmm. How can individuals distinguish between the seasonal flu and H1N1?
Well, it's not that easy to distinguish between them because they're basically present with the same signs and symptoms. We distinguish between them clinically and epidemiologically because of the time frame that we just don't normally see seasonal flu. Mm-hmm. In all the years, we don't see seasonal flu around here until later on in the season. So mm-hmm. normally we would begin giving vaccines for the seasonal flu in late September, early October. And this year, we've actually started giving them early September. But the point is that normally you don't, you have a lead period to prepare for the seasonal flu. Doesn't come until later on. So this is an unusual outbreak. I mean, it's coming early. It's relatively mild. That's a difference between this novel virus so far and the seasonal flu viruses. Mm-hmm. Seasonal flu viruses can cause very significant illnesses in people who have an underlying medical condition like asthma, mm-hmm. Some respiratory condition, diabetes, either diabetes 1 or diabetes type 2, 1 or type 2. People who are on medication that interfere with the regular functioning of their immune system. The seasonal flu virus is usually much more virulent in that way. Mm-hmm. Certainly, any influenza virus is going to be a problem for people who are in a risk category. So, with the novel flu, women who are pregnant, again, people who have chronic illnesses, people with immune problems, the very young, up to 25 mm-hmm. years of age, health professionals who are dealing with the public, they're the high-risk group who need to be immunized, and they're normally immunized against the seasonal flu. Mm-hmm. And that's the beautiful thing about the seasonal flu, is that it's an excellent preventive measure to get a vaccine. It doesn't protect you from all of the strains that are around in the influenza time, but it does protect you from the predominant strains, usually 3 predominant strains.
So you're saying essentially individuals shouldn't just stay and try and make their own distinction, but rather seek relevant services.
Absolutely. I mean, I think the biggest thing is that most people know, flu symptoms, the sudden onset, achy, a cough that's non-productive, a low-grade fever, fatigue. I think at that point one shouldn't go to classes or shouldn't go into a dining hall, shouldn't go to a public place, shouldn't go into a gym. Mm-hmm. And we've publicized this, that self-isolation is really one of the most important things to prevent mm-hmm. a surge. Because the whole idea is that the population ultimately is probably all going to be exposed to the novel flu, mm-hmm. and mm-hmm. our immune systems will therefore have a memory, and so it will put us in good stead for later on. Mm-hmm. But mm-hmm. for now, one doesn't want to get everybody who's susceptible infected all at once, mm-hmm. because mm-hmm. that's a surge that's shutting down things, and obviously we want to avoid that. The students, I think, have been very good. We've gotten the word out. Residence Life has the word out. Students self-isolate. They'll call us and talk to us on the phone, and we've worked with Residence Life and the dining services to have the buddy system, so that a healthy student can pick up a tray for a sick student. And I don't think, from what we've been seeing, I think maybe 3 days, 4 days, and somebody's really over it and ready to, not infectious and ready to go back, into the classroom.
So, from what you've been saying, lots of precautions have been taken, lots of information has been passed around the campus prior to students coming back, as well as since they've returned to the campus. And how have all of these helped with dealing with a challenge which you saw at the beginning of the school year?
Yeah, I think been very helpful. I guess I'm reflecting as we've been talking. One of the things that I haven't stressed, and I really should stress, is strict hand washing.
Yes.
Because the virus is spread in one major way, what we said before, by the droplet spread. But the other is that people who cough into their hands or sneeze into their hands and then open the door knob, the virus gets deposited on then plain surfaces, and it can live for a couple hours.
Yes.
So it's very important for people to be aware of that and to do frequent and good hand washing. For example, we tell the resident advisors, the resident directors in the hall, if you're going in to a room to do health inspection, obviously you're going to be opening the door. You have to make sure that at least you use a hand sanitizer, afterwards, or get to a place where you can do the hand washing, which is supposed to be hot water with soap, and as long as it takes to sing happy birthday, is what the recommendation is.
And I notice you've also, through student services, Residence Life, and all the areas, you've been making the hand sanitizers available in a lot of these public areas.
Yes, the health and safety, Mike Malloy, the health and safety officer for the campus, has been really very aggressive at doing that. We started that on our own in the health service last year. We just thought it was a good idea, and actually we had the novel flu in the back of our minds back then. So I think we had a jump on that, but Mike has done a great job in getting those into the residence halls and other public places.
So what do we do when we go to the gym?
It's very important. First of all, you don't go to the gym if you feel like you're coming down with something.
Good.
And certainly if within 12 to 24 hours after that feeling, symptoms are going to be prominent. And you stay away until you're feeling good again. If you're well and you go to the gym, it's very important to make sure that the equipment that you use is wiped, and there are, I believe, hand wipes in the gym for that purpose. And for wiping equipment only, there are separate wipes for taking care of one's hands. And I think that's very important in the gym. Stay away if you don't feel well, and if you go during this period, looking all the way through to the spring, very carefully cleaning the surfaces that you're going to be touching, and cleaning them before you use them, and cleaning them after you use them.
And I suppose the same instruction would hold for the labs, computer labs, etc.
Yes, yes, absolutely. And again, just quickly to the, we talked about the vaccine for the seasonal flu, which has been available in the health service for 2 weeks now, and we've been administering several a day. We look for students who have a high-risk problem, like the people who have asthma or diabetes, and we try to get to them first. But any student who asks for the vaccine, we have enough supply, so they'll get it. Where we have been designated a distribution center for the novel vaccine, which should...
I tell you what, let's come back and talk a little bit about that. Okay?
Certainly. Right.
We'll be right back on campus at SUNY New Paltz with our guest, Dr. Peter Haughton.
Take a step up in your career with a master's degree from SUNY New Paltz. The graduate school at SUNY New Paltz offers masters in a variety of fields, including business, education, science and engineering, fine and performing arts, and psychology. Our faculty will help you get what you need to advance in your career, and our classes are geared to fit your schedule. A master's degree from SUNY New Paltz. It's what your career needs.
Welcome back on campus at SUNY New Paltz. I'm Devon Duhaney, and my guest on campus today is Dr. Peter Horton, the Director of the Student Health Services here on campus. And we've been talking about the novel H1N1 flu, or swine flu as it's more generally called, as well as the seasonal flu. In the section just before we went off on break, we were talking about the vaccines. What about the H1N1 vaccines? They are now available.
Yes, the Student Health Service has been designated as a point of service for the vaccine. So we'll get a shipment probably within the next 2 weeks. It'll either come directly from the manufacturers, or we may have to pick it up from the Ulster County Health Department. Either way, we should have it. And
but this is just going to be provided for students.
For students, the high risk is up to 25 years of age.
Okay.
And yes, it will be taking care of students only.
Okay.
The other folks on campus, staff, administration, faculty, usually, as they do with the seasonal flu, really need to be in touch with their medical home provider.
Yes.
And so that would be their primary caregiver, physician, clinician, and make sure that they have a supply of the vaccine, of the novel vaccine, and that those folks get it. We'll give it to students. We give it to students who are at the age group is high risk, but within the age group, people with the conditions I talked about before.
Beautiful. Now, we've been talking all along about the H1N1 flu and the services that that's provided through the health center. But there are a number of other services that the health center provides for students, right?
Yes. Well, it's like going to your family doctor's office. Basically, we have...
And all students who are registered are eligible for these services? Absolutely,
yes. And the physicians who work in the service are all board-certified family practice physicians who most of them have their own busy private practices too. But they've worked with us for many years, and they enjoy taking care of young people. It's a challenge to take care of young people, especially young people who are away from their home community and away from their parents. And it's more the younger they are, so the entering freshman students, the younger they are, the more challenging it is. There's fear of going into a medical facility on your own when in the past you've gone in, parents go in and the doctor usually talks to the parents and not to you. And here we are sort of treating you as the young adult. And so it's scary. And I have to keep reminding my staff that we're really dealing with young people who don't have much experience with health services, and that you have to be careful with your language. They know that you have to take more time explaining. And on the other hand, a lot of students really are not well educated about primary care health services. If they're not well within 24 hours, right on, the doctor misdiagnosed.
Yes.
So there's a fair amount of just education that needs to be done in the student population, particularly the new ones. But pretty much we do most things on site because we have family practitioners. We don't have x-ray, and when an x-ray is needed, of course, we'll order it and we help the student get to where they need to get. We really would hope that students reach out to us, especially the new students, regardless of what they've heard, because on every campus you hear horror stories about health services. there isn't a campus in the United States where you don't hear that. For the most part, they're really fables. But, you know, we hope students will reach out, call, ask questions, because the staff's really knowledgeable and can help them navigate the system around here.
Healthcare, health reform, health insurance reform, topical issues.
Yes.
What are your views on how the discussions are proceeding? Will there be some reform?
Yeah, well, I don't foresee reform in the near future. Why
do you say that?
It's a very complex system. Just the healthcare system itself, in any country, but in our country, it's very complex. There are many different powerful players.
Yes.
And their views and their needs have to be listened to, taken into account. So I don't think President Obama would want to sort of refurbish a house when the foundation is already rickety and probably broken. It doesn't make sense. I think you have to really focus on the foundation, and there needs to be a lot of focus on the foundation. I think it would be a waste to pour trillions into quick so-called reform. You'd be bringing in, say, 20 to 30 million people who are currently disenfranchised, but you're not bringing in any more healthcare staff who are already overextended. So it's a big problem. I think a lot more thought has to be given to it, probably looking at fixing pieces of it before we really get anywhere.
And I suppose we won't have the time on this program to even explore a lot more of the issues related at all. But thank you so very much, Dr. Haughton, for being with us here on campus. Really appreciate your responses to the questions and the information provided re swine flu and seasonal flu. Thank you for being with us on campus. I'm Devon Duhaney. My guest was Dr. Peter Haughton, the Director for the Student Health Services here on the campus at SUNY New Paltz. Do join us again next time on campus at SUNY New Paltz.